I think it's a. I could go off on a more general riff about the failure in medicine to deal with the person and to deal with the introspective element, or what's called the subjective. I put that in quotes. Element that's always present in any kind of science, knowledge, interaction with yourself, interaction with another human being, interaction with anything. And it's always a factor. And just this art of awareness, for me, has become what has been very important for many years, and it's just becoming more important. So the body mechanics and the art of awareness was just something that, you know, I had to pursue.
What led you to write your book, Back Pain Solutions?
Well, I'd been practicing for about 20 years, and in a lot of different settings. By that time, I had come out to Southern California in 1998, and I had a small practice, what they call a boutique practice. I set up an office in my home and saw Alexander students and people who wanted physical therapy. I had additional training in something called mechanical diagnosis and therapy, which is a school within orthopedic physical therapy, musculoskeletal, dealing with a lot with back pain. And a lot of the people that I saw over the years, both there and in various clinics that I worked, and hospitals, a lot of the people that I saw were people who had gone to one or two chiropractors, gone to a number of physical therapists, had all kinds of injections, they may or may not have had surgery, they were told they have a disc, there's nothing they can do about it, they had chronic pain, the gamut. And I was able to, using the combination of the mechanical diagnosis and therapy and the Alexander and sensory awareness work, to significantly help enough people for me to realize that, and it wasn't like I'm some kind of special healer, you know, I know something, that's for sure, but it wasn't like a puffing up of my tremendous skill. I was using the methods that I had learned, and these were methods that are open, they're out there. The mechanical diagnosis and therapy, which is also sometimes known as the McKenzie method because it was formulated by a physical therapist named Robert McKenzie. But there's been a tremendous amount of research now, over the last 30 years especially. And I was getting frustrated because I was still seeing people, and I've written about a couple of them in the book, some of the cases. There was a woman that I call Karen who came to see me, and she told me it was her saga of her back problems were a horror story. And with a few simple, very specific exercises that were designed for her, and the Alexander body mechanics training and the level that she got from that was enough to make a huge difference. So she said for the first time in she didn't know how many years, she was able to manage her problem. And she said, Bruce, you should write about this. And I took her up on it, basically.
So walk me through the main chapters of the book.
Well,
tell me how you structure this book.
Right, I don't want to, give a whole disquisition on the book. Well, the preface I wrote, I titled, "Who is this book for?" And it's kind of an unusual book in the sense that this is just how my brain works. I go from what seems to be very theoretical stuff to the very practical, and I try to make as much of a connection as possible. And some people have had trouble making that link. sometimes.
Yeah.
So I wanted to write something that a patient, somebody who had had back problems, would be able to read and find, at least I said solutions. They would be able to find something in there if they have a mechanical problem, which most people with back pain do,
Yeah.
that they would be able to do something that they could say, I am feeling better from doing this. So that was one thing. At another, from another point of view, I wanted to write a kind of a manual that I could use with people who would come to me specifically for the Alexander technique. They might not have, most of those people had might have some kind of pain issue that they dealt with, even though they may not be dealing with much of any kind of acute pain when they see me. But they wanted the Alexander technique, they wanted training in basic body mechanics, have better posture, whatever it was. And I wanted to have a manual that I could get, something written that I could give to them. So that was also what I factored in. And a big part of it was trying to deal with the schizophrenia of my career as a physical therapist. On one level was physical therapy, and another side it's the Alexander technique. How do I put these two things together?
Yeah.
And then what I came up with was the notion of posture movement, therapy, and education. So on one, the term posture movement, I haven't seen that anywhere else. I came up with the term because I didn't, at that time when I was writing it, I wanted to get away from the implications that the word posture has for many people, which is a kind of a static, I've got to hold myself in one position.
Right,
you
right.
know.
Yeah, all right.
It's
That's
definitely
painful
if
just
I'm
looking at
sitting looking at that.
Yeah.
And I give myself more of a double chin than I have now. Actually, I sort of like to move the chair so I can sit on the edge because I feel like I'm sinking into the.
Yeah.
And as I do that, then the picture is getting a little bit.
That's the main one. So
Oh.
this doesn't matter so much.
Oh, okay.
Fine.
So as long as I'm fine as far
Yeah,
as you're
yeah,
concerned, I'm
yeah.
not going to be concerned with the
Yeah.
picture. So that was a big motivation for the book. I'm talking about this because I don't want to go through the book chapter by chapter.
Yeah.
I'm trying to give the
Yeah.
overview of
Yeah.
where I was coming from in writing it.
Mm-hmm.
That I wanted to show, I wanted to figure out for myself by formulating it better
Mm-hmm.
how the two aspects of what I was doing really fit together.
Mm-hmm.
And it's interesting that the therapy that I do is very educational.
Yeah.
It's very, I'm working with the person, I'm dealing with awareness and getting people to notice things about themselves. What I talk about being in the book about being a personal scientist.
Yeah.
And on the other hand, the thing is being an Alexander technique teacher and going through the certification process, you don't have a medical background. Most people don't have medical backgrounds who go on to become teachers. They're coming
Yeah.
from the arts, they're coming from any number of professions or places. And yet, a lot of people will go to an Alexander technique teacher who's not a physical therapist, and they feel tremendously different if they have a back problem, if they have the shoulder problem. What is going on? They're getting some kind of educational work with the teacher, and yet the effects can be therapeutic. So there's an intermixture there, and I wanted to show that. So I put basically posture movement issues and how to deal with them on a kind of a continuum, with therapy at one end, where you would say the chiropractor or the physical therapist or the osteopath who's gotten to the point where they're going to do a thrust manipulation on somebody.
Yeah.
And let's say it just so happens that it happens to be the right